The provided image is a coronal view from a chest computed tomography (CT) scan, showing the thoracic cavity and its major anatomical structures. In this view, both lungs appear prominently as dark regions due to the low density of air, which absorbs very few X-rays. The lungs display multiple branching airway structures, consistent with the normal distribution of bronchi and bronchioles. These branching patterns resemble a tree-like formation and are typical of healthy lung aeration patterns on CT imaging. The central airways, including the trachea and main bronchi, are also visible, positioned vertically in the midline before dividing into right and left bronchial passages. Surrounding the lungs, the bony structures of the thoracic cage, mainly the ribs and segments of the spine, are seen as brighter, denser areas. These bony contours help maintain the shape of the chest cavity and protect the internal organs. The vertebral column, located along the midline posteriorly, appears as a sequence of repeating oval structures, each representing a vertebral body. The ribs are visualized curving outward from the spine, forming the protective ribcage. These structures appear dense and white, consistent with normal bone tissue on CT. Between the lungs lies the mediastinum, though in this particular slice, soft tissue structures such as the heart, major blood vessels, or lymph nodes are not distinctly shown, likely due to the specific window settings applied to emphasize lung parenchyma. Lung window settings typically increase contrast between air-filled spaces and soft tissues, making the lungs appear darker while reducing the visibility of other mediastinal components. No specific abnormalities can be conclusively identified from this single image alone. However, the overall symmetry of the lung field suggests a generally balanced expansion of both lungs. The airways appear patent, and no large masses, fluid collections, or significant areas of consolidation are apparent in this view. Nonetheless, interpretation of CT images always requires multiple views, axial, sagittal, and coronal slices, along with clinical correlation and radiological expertise. This image serves as a clear example of how CT imaging provides detailed anatomical visualization of the lungs and thoracic cavity. It highlights the branching airways, the expansion of the lungs, and the structural framework of the ribcage, all of which are essential for evaluating respiratory function and identifying potential pathologies in a clinical setting.